Okay, fantastic. Happy Tuesday, everyone. Welcome. I see so many familiar faces on here. Thank you guys for joining us tonight. I am Dr. Stacy Holweger, and I am joined by Dr. Tim and Dr. Cathy Tag, and they are going to be doing this Zoom with me this evening, sharing some amazing information about LifeWave, about our stem cell activation technology, what it is, how it works, how it can help you. And of course, don't worry, we are definitely going to get to the Q&A portion a little bit later on tonight. So you'll be able to we'll be able to answer your questions. Before we get started though, I do want to share our disclaimer. I am not a medical doctor. Doctors Tim and Dr. Cathy are both chiropractors, so they're not medical doctors either. So we are not here to give you any medical advice. The information we're going to be sharing tonight is for informational purposes only. Please check with your doctor, your healthcare practitioner, whoever's in charge of you, what's going on, if you have any specific questions about your conditions and things like that. We also will not be discussing any diseases or any syndromes. So if you have questions, and I know you will, please reference the organ in your body that is impacted, or the system in your body, or whatever symptoms you're experiencing, and we'll do our best to be able to address those questions in regards to that, because LifeWave and the information that we're sharing tonight is not intended to prevent, treat, cure, or diagnose anything at all. Remember, this is for informational purposes, but definitely get your pens and your pencils and your notepads, because I really know that you are going to have a lot of things. I am going to start off by sharing the bio that Dr. Tim and Dr. Cathy sent to me. Okay, so these two rock star chiropractors in October are celebrating their 21st year anniversary serving people of West Michigan. I personally had the pleasure of meeting Dr. Tim and Dr. Cathy when I was up in Michigan about 10, 12 days ago with Dr. Dawn, Susan Verholst, and Cindy and Casey Johnson and many of their teams up there. And Cindy and Casey and I were able to have lunch with Dr. Tim and Dr. Cathy. So it was wonderful. And that's when I asked them, I said, oh my gosh, I'm enjoying this conversation and listening to you both and what you are bringing to the table already. Could you come on one of my patching Zooms that I do and share your expertise and information and what you do and how you found LifeWave and how it's impacted your lives. So I want you to know that I got to personally meet them as well too, which I love. So thank you guys for agreeing to be here. So they have supported and empowered their patients to understand and implement more of a holistic paradigm in health and healing shift through chiropractic care, customized nutrition, and wearable LifeWave technology. They are influencing and helping people obtain a better quality of health and life. They've been married for 27 years and reside in Grand Rapids, Michigan with their 2 children. So thank you, Dr. Tim and Dr. Cathy. I would love you both to share a little bit about what you do in your practice, who you are, because you both bring very different things to the table there. I know, Dr. Cathy, you really focus a lot on energy medicine and muscle testing and things like that with the nutrition component. So could you guys share, what you're doing? And then, of course, tell me how LifeWave entered into that in your practice.
Sure. Thanks for having us, Dr. Stacy. We really appreciate it. And, we've been in practice for 21 years now, and it's just been a normal progression of what's the next thing that we can do to help our patients. So, and we have a saying in the muscle testing arena that I do to customize nutrition regimens for my patients. We say, follow the energy. So we followed the energy. First, we had chiropractic, right? We're trying to release the body's energy, release any nerve interference. And then as time went on, we realized that the adjustment is great. It's still great, but it's even better when you have the right nutritional resources. And then a few months back, I had a patient come in. I hadn't seen him in a while. And previously, when we saw him, he had gray hair, which there's nothing wrong with gray hair. But when he came in after not seeing him for a couple months because he was traveling, he didn't have gray hair anymore. And I've known this person for a while, but it's a little awkward, a woman to woman saying, "Hey, great hair color," right? That's normal. But, to talk to a guy and say, "Hey, I like your hair color." It's usually not the conversation you have, right? So I took care of him, didn't say much. And then we're ending the appointment. And he looks at me and he says, "Kathy, didn't you notice my hair?" And I'm like, "Well, actually I did." I'm like, "Great color." There's hair club for men. I don't know. Right. So I don't, trying not to make things obvious or uncomfortable. And so he's like, "No, I didn't color my hair. I wore these patches." And so my brain went to, okay, so what's in the patch? What chemicals in there? What are we doing to manipulate the body? And I drilled him pretty well. And he's like, "Nope, there's no chemical entering the body. And it has to deal with energy." And which is something that I know you should know about, because he had gotten my nutritional services before, and he knows that I use frequencies and reflexes to help people have a better quality of life.
Wow.
And I first learned about LifeWave. It was we're in different rooms. We have different exam rooms, and I had a patient of mine, and I would, when I'm checking his back to give him an adjustment, he had a sticker on his back, and I always joke, I'm like, "What is that? What there's a sticker on your back." And I thought it was like one of the acupuncture patches, the dermal, the transdermal. And he started telling me about it. And because in our office we do chiropractic and advanced clinical nutrition, and we started doing advanced clinical nutrition because about 10 years ago our patients would get better, but then they would stop. There'd be like, "There's just a little bit left over, Dr. Tim." And 5 years before that, we could take care of these things with chiropractic and opening up the nerve supply. But we're in the era of GMOs. We're in the era of glyphosate. We're in the era of all these radio waves, all these electromagnetic waves going throughout our body, causing inflammatory processes to the cells and the tissues. And he was telling me all about all the research with LifeWave. And I used to work on jet engines. I'm an Air Force vet, so I'm a big time troubleshooter. So A plus B must equal C. So Kathy and I both decided to try it, and we never implement anything into our office. We've had people coming in and, "Here, try this and try that." It's like, "Nope, get out." But LifeWave was a whole different story. And as soon as we tried it, I felt, and I take care of my body. I weight train. I try to eat right. We do advanced clinical nutrition. We give our body what it needs in the right amount. We get chiropractic care. So our homeostasis is well. But I felt better. I felt stronger. And one thing I noticed too, I just felt more toned. Not tone as in like, weight training or fitness, just my face and my skin, my eyes, just everything was more toned. And then we decided, it's like, we need to show this to our patients. And folks,
we're getting lots of good reports.
They love it. And they're getting better. These patients, we got them better most of the time with our chiropractic and clinical nutrition, but it seems like with the patches, they don't need to take as many supplements, and their improvement is just increased. Does that sound about right?
That sounds about right.
I mean, it's awesome technology. I love it.
For me personally, after working on people all day, you're doing the adjustments, and at the end of the day, you can get pretty sore. At least I could. And the biggest difference for me is that I'm not sore at the end of my day anymore.
Me neither. And after weight training, I'm not sore anymore.
Yeah. So that says a lot of things.
A little personal testimony there.
Yeah. So I love how you said we've always done chiropractic, and then things shifted in just our life, right? Lifestyle with toxins and things like that with food. So we implemented what we thought would be next best to work with our patients. Clinical nutrition. That made big differences. We saw changes. But again, here we are in a place where things have shifted again in our environment, in our food, and what we're exposed to. And then here enters LifeWave to complement what you're already doing, which has been proven to work in helping your clients achieve that homeostasis. And I love that you incorporate that. And I definitely want you to talk a little bit more about that, Dr. Cathy, with your patients with the energy medicine and the muscle testing component. But here enters something that's simple, easy, effective, right? Super accessible, not anything that is crazy, that your patients can implement daily to help them in that journey of wellness, right? In seeking that homeostasis. So can you talk a little bit about when a client comes into you, then what you're adjusting them, you're doing the different maybe acupuncture points or your muscle testing them. What does that look like where you say, okay, here are the nutritional supplements you need, or here are the types of foods, yes or no? What does that look like for you? And how do you incorporate those patches into that?
Sure. So first things first, there's one standard principle that I use to make sure that I am moving the patient in the right direction. And that is looking at their biofield, their human energy field. Acupuncture would call it like chi. There's different cultures that call it different things, but your life force.
Mm-hmm.
Now, so I can't see it. Some gifted people can see it, but I can measure it. Okay. And actually, most people could see it if you had like night goggles, because it's the heat emanating from our bodies. And hunters will actually wear special clothing so that they can get closer to whatever they're hunting to get a better shot. Okay. People can identify with that, right?
Oh.
They're actually closing it off so that the animals can't perceive that they're so close.
Yeah. There's a company out there, and they make camouflage, but they use, isn't it funny? They use a lattice. It's the same type of I'm gonna say fabrication. It's the same
Structure,
concept. It's the same structure. It's the same concept as the patch. But you go on YouTube. These guys, they get their camo on, and they're walking right up to these big game animals, because the big game animals can't see it, because they can't see the infrared light and the energy coming off their body.
Wow.
It's crazy.
Right.
But again,
I have not heard of that.
Yeah.
So in that scenario,
I'm not trying to it's called Hex, HECS. I'm not trying to endorse them, but it's interesting how they utilize that as a way to
kind of in reverse of what we're doing. We're trying to like expound, increase the field.
And they're blocking it so the animals don't see them, so they can take them out.
Exactly.
I didn't interrupt that.
Oh no, you're good.
No, I'm glad you did, because I'm sure we have hunters on here, and men will. Absolutely, that's good.
Yes. So if it doesn't expand the field, so when someone comes in, right, we adjust and we make sure that their nervous system is clear and operating as much as it can with the adjustment, the help of the adjustment. And then for the nutritional assessment, I see, where's their field? Is their field minimal? Is it lopsided? In order for someone to obtain health clinically, they need 3 to 5 feet around them symmetrically. So if you can kind of picture like an invisible bubble around yourself, okay? I want to make sure that their field is at least 3 to 5 feet around them before they leave. Okay. Now I have patients that have super fields, 100, 200, 1,000 feet.
Wow.
Depending on how long they've worked with me. But what I have found clinically is that when I reflex test my patients, and we have the different variations of the patches, I test to see which one their field prefers. And as long as it's expanding the field, that's a match. Nice. And I really like the fact that you're using your own stem cells. So you're basically, I like to think of it as you're recycling your own energy, your own light, because as your heat leaves, then it reflects off the patch, and then it goes back into the body more purified. This is how I see it in my brain. And, and so we're utilizing resources that have gone neglected, right? Because from my understanding, when I was listening to you, when you came to Michigan, right, we lose half of our stem cells when we're 30, and then we're only using like 10% of them by the age of 60. And so we restore, I think you said up to 30%, we gain back with the patches. And so that's great because we're just trying to maximize our life expression. The biofield is an extension of our nervous system. So if we can get that expanded, the bigger the field, the better. And so I have found clinically that the patches, they will expand the field.
I love that. So that you can actually get back up to your full stem cell regeneration point. It just is going to take time. So if you're in your 60s and you only have 10% that are active, it's going to take you at least a solid 6 months to get the other 90% woke up, get them moving, get them mobile, get them activated and elevated again. So I think probably what you're thinking with the 30% is the glutathione. So x39 is going to elevate your glutathione 30%, which is huge. Yeah, I figured that was probably what you were talking about because we talked about that quite a bit too with the glutathione patch. So yeah, so definitely I love that explanation. I can see that. You guys can all see the man with his arms up and his legs out, right? And then his biofield going around him. I don't know if you've seen that before and after picture of just even that we put the Alavita patch on and how it expanded in seconds. I'll have to share that with you. It's on myalavita.com website, but I can definitely see that picture myself. And that is huge, right? Because your light, we know your cells shrink as you age. And so that means your light is that you're emitting is shrinking as you age. And so your job in chiropractic and clinical nutrition is to help expand that light, right? Expand that biofield to expand the functionality of the cell-to-cell communication and what's happening inside of the body, in a biochemical reaction as well too, right? All of those, everything's communicating.
And it's a life expression. So, the biofield is based on the science of epigenetics. And epigenetics, a lot of people will say, oh, I inherited this. This is just my fate. The genes, they just are the genes. I can't change them. But the science of epigenetics says if you can change your environment, internal and external, you can change the way those genes are expressed. So that means that if you give your body the right environment inside and out, you don't have to follow the path of destruction that the genes would take you if you weren't taking care of yourself in your environment.
Exactly.
And that's a big deal because a lot of people kind of default to that. And I totally understand that, they've experienced family lines and, well, grandma had this and mom had this, so I'm going to have this. But what a lot of people neglect to pay attention to is that a lot of those environmental things are the same for all of them. So what would happen if you altered that environment in a positive way? And the science of epigenetics says that only 2% of hereditary issues are really valid. That 98% of what's talked about in the gene conversation can be changed with the right environment. And so that's a huge opportunity for change and for health.
Right. And I'm 100% on board with that. Absolutely. That is very true. And we're conditioned and programmed to believe because then you go to the doctor and you fill out those forms and they want to know all the family history of everybody's diseases and everything. And it's like, nope, none of that. None of that exists.
There is a shift going on though. And that's why this is a great time for people to get into LifeWave, because I've noticed over the past couple of years, our patients are less skeptical. Even me, I'm more of I think mechanically, and I think, with the nervous system and intervention, I never really thought about light and energy up until about 8 years ago. You know, I'm like, you guys are crazy. You're not. But then we started applying it. We started getting these dynamic clinical results. But folks, people, they don't really question. They're like, hey, if you think it works, and I always like lift my shirt. Hey, I'll wear these patches too. You know, and then again, like with X39, you tell them it's, you know, it's non-transdermal. The infrared light, it hits the patch, the lattice, it's sent back into the body. It stimulates the copper peptides, which goes and activates the stem cells. And that's a good thing, you know, because stem cells are undifferentiated cells. Let me make sure I made that right. So they can turn into anything. So we need that activation to occur. And that's the beauty of just in our office, chiropractic clinical nutrition, and this activation of stem cells. You know, and you know, along with the other patches.
We're releasing the body's wisdom,
right,
to make
allowing it to heal.
Right. And to allowing it to direct which way to go. Right. Because our bodies are awesome in design. And I'll be the first one to say that I'm not smarter than the body, but I do know some things to help nurture it and to help the life expression be as good as it can be.
Absolutely. I love that you know, Dr. Tim, you gave a very simple and easy explanation on how these patches works. I hope you guys caught that, because it was that simple. And it really is that simple. We put the patch on and our body's light reflects back in a very specific wavelength, activates the peptide, and that turns on that stem cell activation inside of your body. And your body knows how to heal itself. So this is perfect, perfect explanation. So I'd like for you to tell us, obviously you're using X39 with your patients. Is that your starting point with your patch? And then what do you do from there? How do you determine if they need another patch? Are you using IceWave for their immediate pain? Or what does that look like? Because you're busy, right? You have a lot of patients that are coming in your practice. And so how does that work inside of that session inside of the room?
So we usually do start with X39 and see how the body prefers that. I would say probably 90% of the time, body wants X39. But it depends on their symptoms too, because I've had patients that for whatever reason, whether it be, you know, they're just very toxic, or there's just certain challenges that all of us have had to face over the past couple of years. I've had symptomatic people that couldn't sit down. Their sciatica was so bad, and the adjustment in nutrition would be helpful, but it wouldn't take it all away. And so what I've been finding with that is X39 and carnosine have been really good for that. I've used the IceWave a handful of times. And we had a patient that came in, and it was like an emergency call. I went in on the weekend, and one of my patients, like, my dad, he's just not, he's in so much pain, I don't know what to do. And I was like, okay. Well, and it was actually the first time I got the IceWave out. I'm like, well, let's try this today. And so what happened is that he was amazed, because within 10 seconds of finding the right positioning, he's like, oh, that's a lot better. And before that, he couldn't sit still. Like, he was like, right. And finally, so we used the IceWave, and I was able to do my muscle response testing and see what was going on. And the frequencies said that he was struggling with a kidney stone energy. And he was supposed to get on a plane to go back home the next day. So we were able to say, hey, this is what we're finding. I was able to suggest some remedies to help that energy calm down. And I said, when you get back home, go see your doctor and get that taken care of. And he was so grateful, because he could get on the plane, and the pain was minimal after that. But I wouldn't have been able to know.
You couldn't even figure it out.
Yeah. I mean, you know, you try to do this with, you know, that's, I mean, that's, you know, overrated.
Oh, that's amazing. So Dr. Tim, what about you? What have you noticed or how have you incorporated the patch with your patients when they come in? Do you have anyone that kind of sticks out?
With me, I'm more direct. I'm just kind of
You
like
pull your shirt up and you say, look, I've got the patches on.
Basically, he does that and he says, have Kathy test you. And then, and then we like talk about what we find based on what happens.
Yeah, I guess a lot of my patients would, we get low back pain patients and neck pain patients, all these different types of patients. But whether they have symptoms or not, I'm encouraging them to get on LifeWave because this is about homeostasis. And we're being bombarded with all these toxins and environmental chemicals just from all over. So if you want to have better results with chiropractic care, you want to have better results with clinical nutrition and the healing of the tissues. That's where like the stem cells and all this, the reflected light going back into the tissues in the body and healing all that. And I always tell patients, it's like, guys, it's so easy. And it's actually, in my opinion, it's fun. You get dressed in the morning, you put your patch on, when you go to bed at night, you take it off. But what you get in return in reference to how it benefits your health, I mean, I can't even describe how great it works. And one thing about our office too, we get the worst of the worst patients in our office when there's a lot of like low back pain or neck pain or just all these patients that no one else wants to take care of. They're like, oh, go see the tag team. That's our name, and that's people call us the tag team. And it is such a wonderful addition to our office, and it's easy and it's fun. And it's what I like is, I want more people wearing these. And it's like, I think the business model that LifeWave has is, anybody can like lift up their shirt. You gotta be careful saying lifting up my shirt. Just show them your patch and say, you need this. Well, why? Because it reflects your light rays and it nourishes and it activates your cells and tissue stem cells and like what I was saying before. Sorry, Kathy. People are less skeptical over the past couple of years. They're willing to try anything. That's the era we're in right now.
Yeah, I totally agree with that. I love that explanation. Keep it simple. It doesn't need to be long, drawn out. It doesn't need to be technical. Just keep things simple. So I appreciate that so much. We do have some questions in the chat. And if you're okay with me asking you a couple questions, would that be all right if we answered some of their questions?
Sure.
Okay. So someone is asking, how do you work your business in your practice as far as do you sell retail or do you actually have them purchase one of our wholesale packs or what does that look like for you in your office? Because we know offices do things differently.
We do both.
Yeah, we do both. There's some patients that come in and they're like, I want this right now. So what we do is we sell them retail for the first month and then we sign them up. It's as simple as that.
Yeah, we point out that they get a better price, right? But some of the people, especially the ones that are in pain, and we figured out that they like I said before, x39 and carnosine. Well, it's better to have them on hand and have them have the benefit of as soon as possible, right? Versus, waiting the few days to get them in the mail. And usually when I do that, when it's a pain thing, I get out the ice wave, I get, whatever matches them, and then I give them the choice, right? And so we kind of transition them that way. But then we also, sometimes I got to put another order in and I don't have them. So, but either way, our patient, we've been in practice for a while and our patients trust us. And they know by how we've conducted ourselves and how we've helped them in the past that we're truly, genuinely trying to help them. And so it's really not a sale. It's a recommendation. And, most of the time they are willing to hear and willing to at least try.
And it works every single time. I mean that. I've had patients ask, well, how long will it take me to start feeling better? and I've observed something. The more you're in tune with your body, the healthier you are. Let's say you stay fit, the lesser amount of medications you're on, it's going to take longer to feel better. But I notice, like with myself and Kathy and our fit freaks and our patients that are in tune with their body, they feel it right away.
Yeah, they
That's
feel
a little observation.
Yeah, we have different ranges, and maybe they haven't gotten the, health is a journey, not necessarily a destination, right? We all want to not have the symptoms that we're experiencing, of course, right? But most people, even if they haven't gotten to check off the thing on their list saying, I don't have this anymore, they can tell that there's other things that have improved in the meantime. They sleep better, or whatever the case may be. It could be anything. Like, I didn't realize, I thought I just had to live with this issue of not sleeping well or not digesting well or whatever it is. And since I've been wearing the patch, this has been better. Maybe they haven't obtained, the ultimate goal, but yet their body's working toward it.
Well, we've had a couple of female patients, and it's kind of funny, but they're like, what did you guys do to my husband? He won't leave me alone. If you know what I'm saying.
True. Yeah.
It's
So
like, well, when the body's working better, when the stem cell issues,
everybody's happy.
Exactly.
Again, you got the X39 patch, which cardiovascular and helps, strength and healing after weight training. That's what happens, guys. And it's like, Dr. Cathy and I, our main goal in life is to help people live a better life and to see them move on. It's as simple as that. We've had people in our families that have, I don't want to get into it, but medicine destroyed them. And our main goal is we want to see people just get on with their life. And
have other choices, right? Have other choices. We get programmed in thinking, this is the way we go to the doctor. This is the way we get our drugs. This is the way we get our surgeries, and don't expect much after that. I mean, and we don't have to go that road. There's so many things out there that you can pay attention to and try and actually apply to your lives and get a better result. The definition of sanity is to do the same thing over and over and expect a different result.
Exactly. Oh my gosh, I love that.
And with our patients that we give patches to, most of them, I tell them, hey, you want to vitalize, optimize, and now capitalize? I mean, people need this patch. And it's like, we're going to start showing them how to make it into a business, because it's not that hard. I mean, what a great thing to be able to get your own body healthy, and then you can get all those around you healthy.
Okay, say that again. Vitalize.
Oh yeah, what'd you say?
You said vitalize.
It's time to vitalize, optimize, and capitalize.
There we go.
Optimize and capitalize.
When you're doing good work for people and they're getting healthy, and grandpa's able to start playing baseball again, and Mr. So-and-so is chasing his wife around or whatever, and you can start, you're not sick all the time. You can actually go function. You can go to restaurants. You can live again. People deserve to be well funded for that.
Yes,
absolutely. Wow.
That's my little, sorry about the tangent, but
no, I love that. Vitalize, optimize, and capitalize.
Capitalize.
Makes perfect sense. All right, we've got some more questions in here. So how do you differentiate between anecdotal evidence and scientific evidence when discussing these products and concepts? Do you just stay focused on, here's what my client experienced, or here's what I've experienced? Or do you also throw in some clinical studies or science and research with your patients too? Or is it does it differ from patient to patient?
It differs, because we do have patients that are like, yes, I just need more information, right? And so we've been able to give them some of the websites that you have recommended, Dr. Stacy, and But then, I always point back to, yeah, you can have the information, and information is good, but if you're not going to have an application and a result, then what's the point? I mean, we can, I like to read, but I would rather apply something so I get a better result instead of just reading and being indecisive about, oh, maybe I know it said that. Okay. But I'm still going to sit on my blessed assurance and read some more. You have to, you have to make a decision to take action at some point.
Mm-hmm.
And so, I usually will just try to point out what I'm finding with their reflexes and their frequencies. And usually the patch reflects wanting to help enhance that, correct that, optimize that for them. And I just say, of all the other things, I have people that come in and they spend thousands of dollars on nutritional things for themselves before they even get to me, right? And sometimes they feel like they have a little progress, but they're like, I'm doing all these things. Why don't I feel better?
Mm-hmm.
And I will say, well, because we need to see if it's a match. There's all kinds of different vitamin C's out there and omega-3s and all the things. But if I can test somebody's reflex to see what is the one that their body will utilize the best,
Mm-hmm.
then they are going to get a better result instead of it just being expensive urine because the body didn't utilize it because it wasn't the right match.
I love that. And I think everyone can relate to that because we've all had countertops of pills, right?
Sure.
We've all had bottles of all these different ones. We see the latest and greatest. And I'm also too, Brent will say all the time, like, why do you have all that stuff? Well, I want to see it. I want to feel it and I want to have it in my hand and I want to muscle test it. And I want to see if this is something that I need right now or not, or maybe just have something on hand in case of whatever. Right?
Sure.
I have that stuff, but it doesn't mean that I necessarily need to take it. He's like, but why don't you use it? I'm like, because I just needed to see it and feel it and test it in my own energy field. And then also, it could be a resource or reference for somebody else. But a lot of people don't even know how to do that part, right? And so they just buy it and they take it and it's not even beneficial. So that's why I have so many unopened ones in there because I'm like, I really need it. I just wanted to get my hands on it, really check it out and look at it. And you can't really do that on Amazon too well. So yeah, we don't really need all that stuff, right? And that's what I love about the patches and David had shared this with me when I was doing a Zoom with Dr. Mario. We were talking about clinical studies and things in a private Zoom. And he said, it's not published this way in the studies, but he could see from the studies that using the patch, the people that were on supplements got a 20 to 30% increase in the effectiveness of those supplements. And like you had mentioned earlier, same thing. And so if you are taking supplements, sometimes they're effective in working it and sometimes they may not, or maybe, your body does come into balance more so in that area and you no longer need that one. But I love that our patches work synergistically themselves with inside our body, but also can help the other things that you're doing outside of that. So I have a
point out really quick too, your own light is a match. And so that was like a big deal for me because it's like, yeah, because you have the supplements that could be a match, could not be a match, but your own light, it's a match.
100% a match. Mm-hmm. Definitely. Okay. So real quickly, someone was asking about clinical studies and if we have, where was it at? I want to double check here. Ongoing clinical trials. So let me address that real quickly. Yes, David is always doing clinical trials, clinical studies with people. They are not published, obviously, as of yet, but he definitely has ongoing studies that are taking place. And so do other doctors and practitioners that are testing the patches for different patches, different things like that. So I just want to make sure he knew that. And yes, there are new things coming out. For those of you coming to our global convention in a few weeks, he will be sharing some of that information. live in person. And then of course, if you're watching virtual, you can see that as well too. And there's more to come. We're going to be hitting our 20-year anniversary next year. But let's go back a little bit to your patching and chiropractic. Someone was asking, what do you recommend, or what would you say for scoliosis? What would be your suggestions, recommendations? Obviously, we know what you're going to do with the spine, right? But what would you say to that?
Well, if I think they're referring to maybe a painful scoliosis. I mean, obviously it's not going to correct the curve, but, scoliosis is, I mean, that's a lot of, of course it's congenital. Sometimes it happens after, post-surgical. But if it's for pain and discomfort, I would go with like the X39 and maybe carnosine. Try that out first, since it's a chronic ailment. So I would do like X39 and carnosine if the patient is in pain, or if the person's in pain.
Perfect.
Depending on the degree of scoliosis, if we're talking about something that, they're concerned about, the organs are getting crushed, more structural, then that's a whole different thing. The adjustment is a big deal there.
Yeah.
Along with managing the pain. But if you, chiropractically, you can have curves in your back as long as every single joint is moving within its normal range of motion. There shouldn't be any like overly concern or focus on it, as long as things in your back are moving appropriately.
Perfect. I love that explanation. Thank you. All right. So a lady asked, she said she's going to start dialysis from end-stage renal failure next month. She doesn't know if she's wasting her time with the patches. She doesn't want dialysis, but she doesn't know if there's a chance that her body could have any kind of repair. What would you say to that?
I would say there's nothing that can be counterproductive with the patch. So there's no side effects with that. And the only thing that could happen is that there's a chance that you could get better.
Right. You don't know until you try.
Yeah.
Yeah. And I actually have Tina and Paul, who are customers of ours. And Paul was looking, same thing, not end-stage renal failure, but his next step was dialysis. His kidneys were failing, and they had been for quite some time. And it took about, if I remember correctly, 5 or 6 months. Where that was, the numbers are certain numbers. I want to say it was 14. I don't know. But I remember Tina telling me, because I ran into her earlier this year, and she was like, oh my gosh, his kidney numbers are now within range of almost completely normal. Like, it's taken, this time, but man, we are just blown away using the X39 and the YH, because the YH do impact all of the organs, including the kidneys. So I would say yes.
Yes.
And that's the beauty of reactivating stem cells, because the body is going to decide where to send those stem cells to become newer cells.
Yeah.
Yes. The nutritional component is a big deal with that too. Customization of it, because I've dealt with things like that with kidneys. I've dealt with liver as well. I have one patient that has overcome liver cancer. And I know that we're on a better road. The nutrition with the patches is a beautiful world.
Yeah.
Yeah.
Amazing. So someone is asking, how do you separate your energy from your clients when you're testing?
Well, the reason why it works is that you're able, there's a principle in quantum physics called entanglement. And so, no, you don't separate yourself, but you need to make sure that I need to make sure I'm taking care of myself. So I need to make sure that my immune system is as strong as it can be, right? When I'm going in and I'm entangling myself with someone else's energy, right? But I have also felt effects when I was newer with this, where I would work with somebody and I'd walk away and I'd be like, ugh. I allowed myself to absorb it a little bit more than I should. So you have to have the mindset, how I do it is I say, okay, today I am not going to absorb anything I'm not supposed to. And I'm a Jesus girl. So I say, Lord, there's a boundary drawn, around me. I'm here to help, but I'm not here to absorb their stuff. And so just that simple practice has kept me well and has helped my patients as well. So
it is so true. Yes, we want to be able to help and assist, but yet not take on. Cut the cords. Keep the bubble up.
That's right. That's
right.
right.
Claire, next one in the room, right?
Yep.
I love that. Okay, so we had a question on SP6. I don't know how familiar you are with SP6 or not, but they were asking if it needs to be placed on the acupuncture points. Have you guys utilized that in your practice yet?
Yes, but not as much. Usually what I find is that I want to say that there's a place on the leg, like the ankle part on the left leg, that tests a lot. I find that one as a preference for a lot of patients.
Yeah.
And so, yes, the company has places where it recommends, like their top 5 places where it could be. And so in my office, because I get even more specific. So I look at all those 5 places, and sometimes the patient doesn't care, could do it any of those places. Yep. But then sometimes they have a preference. They only want 2 of the 5 or whatever it is. Yeah.
Thank you. I love that. Yeah, that's the spleen meridian. So yeah. Then they were also asking, what about any type of electromagnetic therapy, like the beamer, the beamer mat? Is it okay to patch if you're using any type of therapy like that? Are you guys
think so. Yeah, I would think so. Yeah.
Yeah. And again, it's non-transdermal. It's taking your own body's infrared light and it's putting it right back into the cells and tissues. So, anything to make that, like Dr. Cathy said earlier, to make that light better.
Yeah. And if you feel like, there's certain times or seasons where the body might be going through different challenges, and you live with you. So I always tell patients, you live with you. If you feel like something is draining you or challenging you more, it's okay for you to question it. It's okay to try something else or try doing something not as often. It's fine. You can try the different things and see what might be working better. So listen to your body.
Yes. Be aware, right?
Yes. Yes.
All right. We had a question. Someone was paralyzed as a young man from in the spine area, C5, 6, and 7. Any suggestions? All over completely. Any suggestions?
It's worth a try. The patches are worth a try. Yeah. The hard part is that when someone has an injury that has been there for a while, a traumatic thing for a while, it's probably going to take longer. I don't know how long it would take, or even if there's a limitation of matter at that point. I don't know. But again, everything's worth a try.
In our office, there's always hope.
Yes, there's always hope, and God's a healer, and we never leave him out of the mix. So,
but it depends on the mechanism of injury. Also, is it like Christopher Reeve? He shattered his atlas. That's the bone that supports the skull. So it depends on how bad the nerve injury is. Was it severed? But there's a possibility it might not be severed. Okay. Now nerves are a little bit different. They can't regenerate. Okay, not as quickly. It's not like muscle or skin tissue, but there's always hope. And if that individual wants me to help them try to find somebody near them to get the ball rolling, I'd be willing to do that.
Okay.
Wherever their location is at. So
thank you. And you're in Grand Rapids, Michigan area. Someone else was asking about that. So they said, taking new patients.
Yes.
There's always hope, always. And we know that the body is created to heal itself, right? It always wants to get back into balance. It's always seeking that homeostasis. So there is always hope that it can get there.
Just one quick story that I like to point this out, because this is something that we knew before we even knew about the patches. But we had Tim went to high school with a student, and he was kind of sickly during the time. And later on after high school, they decided that they were going to remove his spleen. Okay. So they removed his spleen, and lo and behold, guess what? That spleen grew back. And medicine said, oh my gosh, we took this out. The body's doing it wrong. So they took it out again, and he died. So my point is, with that story, right? Whoever heard of such a thing, right? You take it out, it's out, right? You think it's out, but the body said, I really like that. I'm gonna grow that back, right? And then the lack of wisdom that they had to take it out once again didn't end up well. So I like to share that story, because it's like, people have never heard of such a thing, but that actually happened.
Wow.
Right? And his body did that. I know his body did that without the patches. So
yeah, of course.
Anything's possible, right? Anything's
No, we're not
possible.
saying the patches grew his spleen back.
No.
This was 20 something years. I mean, this
yeah.
way
Anyway.
before that. But the point is, there's always hope.
Yes, that's the point.
You know, and it's like, if you're going a health route, and it's not working, you need to like shift and try some new things, because a lot of the stuff out there that everybody's like, well, that's kind of new age, or, you know, even with like, you know, people are sick of research. They're sick of, no, I love peer reviewed studies. I'm a source. I love source. I have, you know, a big stack of research for LifeWave. I've even researched, you know, the copper peptide stem cells. I'm like, oh my gosh, this is like, this isn't even part of their package. I found this all out. But anyhow, I never get past, like, when somebody wants to know more about the patches, once they learn about the body's ability, or the patch where it takes the infrared light, puts it back in, and stimulates certain copper peptides, they're like, I'm sold. That's all you need to say. And it's just like, try it.
Wow.
Try it. I don't need any more research. I don't need any more peer-reviewed studies. If you say it's working, I want to try it. And then they try it, guys, and they're like, oh my God, like, we love this. It's changed my life.
Yeah. And that's the thing too. Yes, LifeWave has, you know, 20 years of clinical studies. There are over 90 different studies, and there are many that are peer reviewed, you know, double blind, placebo controlled. But at the end of the day, you go into the store and you pick up vitamin C, or you pick up vitamin D, or you pick up, you know, turmeric. Are you looking for the double blind placebo controlled study that shows the effectiveness of this supplement before you purchase it and use it? Are you using it because you saw it on Instagram or TikTok, or somebody said this will help with inflammation or your immune system or whatever, and you go pick it up? So I think that's it too. You know, again, you got to do what's best for you, but making sure that you realize that this is working for people. This is working for a lot of people in a lot of ways, really, really big ways. That's really, and we do our testimonial calls, you know, at 9 p.m. Eastern, Monday through Thursday, and people share their personal experiences. You know, so if you haven't hopped on one of those yet, get on one of those, because when you hear them, and Laura and I have been doing this now for 2.5 years. And when we hear these testimonials, we're blown away every week. We're like, oh my God. And now a lot of people are sharing videos, and they're sharing their pictures, you know, before and after pictures, and their pets and their kids and their, you know, their cows and, you know, all the above. They're not hunting the cows. They're, you know, healing the cows. So, but you know, you see this and you're like, gosh, you can't make this up. It's happening for so many people in so many different ways. But I do want to share real quick, because we're almost out of time. So they did say that the vertebrae were severed, the area, the nerve there was completely severed. So I just want to share that with you. And someone else was mentioning that they noticed their neuropathy got a little bit worse after starting X39. And they wanted to know, like, why would it get a little bit worse? Why would the pain be a little bit more in the beginning? Would you have any explanation for that?
You know, depending on the person, I wouldn't expect that to go like continue. If it got a little bit worse and then it got a little bit better, then good. I would say to really look at, you may have a nutritional need, like it woke up, it's waking up the nerve and trying to have that nerve be utilized fully. But there may be the nerve may need some other resources to heal with nutrients. And I would look at that very strongly.
I love that answer.
Well, too, whenever the body's trying to get rid of inflammation, a lot of times it doesn't feel good. I mean, whether you have like a sinus infection or you have a sprained ankle and it's healing up. So, you know, when you start feeling things like that, it's like your body is working, and more than likely there's an inflammatory process which you get the remodeling and repair of the tissue. So that's not always a bad thing. But again, like Dr. Cathy said, that's where it's like, okay, there's clinical nutrition and there's some other.
Yeah, I love that. You know, like when you have a scab and it starts to itch and it starts to bother you, and you're like, oh, and then you like, you know, scratch at it and it hurts. But it's not a bad thing that the scab's there. Thank God it's not gushing blood.
Right.
So I think sometimes we have to, I think people, when they put the patch on, sometimes too, they want everything to go away immediately. And if anything doesn't feel like, you know, if anything's uncomfortable, it's like, whoa, what's happening? What are these pains? And that's a great, because, you know, we've had a couple of those texts, I have today even, of people saying that exact same thing. Well, I noticed more pain in this area, or something right here flared up when I started patching. And, you know, I don't want to say it's common, but it's happened to people. So that's great, that inflammation process, or maybe there's something nutritionally that your body is needing to be able to, you know, help support in that repair process. I love that explanation.
But getting back to the severed nerve and the C5, I would give the patches a try. I would. I don't know if we answered that already. But
Yes.
No, you didn't. That's perfect. Thank you.
Give it some time. You never know what happens when the body's own light repairs itself.
Yeah. And last thing, they mentioned pancreas support. And I know you talked about carnosine earlier when you were talking about helping people with pain using the x39. Have you had any experiences yet with people with the glycation process in the pancreas? Have you used the carnosine for that yet with anybody?
Not yet. Everything that I've been doing thus far, everything has been liver.
Okay.
Which that just means that that's what I've, you know, been handed. But at the same time, you know, you need to look at liver and gallbladder if you're having a pancreas issue, because as the liver goes, that's going to affect how the pancreas reacts. So you can sometimes when you can say, okay, this is my lab value, this is what I'm experiencing, this is what my blood sugar is. Yes, but it doesn't necessarily mean that the pancreas is the problem. It could be liver, it could be gallbladder, it could be spleen. It just depends, right? So it's a very the great thing about expressing your field is that it's a very quantum concept versus linear, right? Like, I have a headache, so my head hurts. So, ow, I'm going to put a Band-Aid on my head. Well, that sounds like ludicrous, right? But with the other organs, that's how a lot of people think, right? Like, I have blood sugar problem, therefore it has to be pancreas. Not necessarily. Not necessarily. Yeah.
Yes. So. Get the body in balance. And that's a beautiful thing about X39 and our Y-Age. The X39 and the Y-Age series, those patches address the organ function, all the organs. So not singling out just one organ, but all the organs. So that's amazing. Thank you. Well, thank you, tag team, Doctors Cathy and Dr. Tim, for being on here with me tonight. I so appreciate all of your expertise, your wealth of knowledge. And I love who you are at your core and your foundation and what your principles that you believe in, because that's very much in alignment with me as well. So thank you for being here. Thank you for being a part of LifeWave and helping other people. And I know that you're going to be impacting hundreds and thousands of people's lives. And I will see you again soon in Michigan, as soon as you guys are free of snow.
Sounds like a good deal. Thanks,
As soon
Dr.
as you're free of
Stacey.
snow, we will be back up. So thank you both. Thank you so much for your time and energy and effort you put into this. So everyone have a fantastic evening. If you didn't get your questions answered for some reason, get back with the person that invited you and they can help get those questions answered for you. Thank you all. Have a fantastic evening.
Thank you.
Thank you. Good night.